I'm Jade Clifton. I'll be showing how to do basic first aid on a patient that has a fracture. So first, I'm going to apply the muzzle. That just makes sure that we're safe, and because it can be painful. And then the fracture's on the front leg, and we're going to just set this baby over on its side. And then, so to place it on a table, we would get a blanket and then set it on there. And then one person would get one side and the other person would get the other, and kind of make like a little stretcher. And that would be the easiest way to get it on the table. And for the front leg, you could put a bandage on it, but sometimes that can make the fracture burst or mess something up. So we're gonna leave that to the doctor for him to tell us what to do with that. And that's how you do first aid on a fracture. Hey, I'm Jade Clifton, and I'll be showing how to do first aid on a patient for bleeding. So first, I'm gonna start off with putting a muzzle on for our safety. And then, so there is a wound on the back left leg. So I'm gonna get some gauze and I'm gonna apply pressure. And I'm gonna check every 3 seconds to make sure it achieves homeostasis. And then I'm gonna get some vet wrap and apply a pressure bandage. Alright, and also you can use a tourniquet if it's not stopping bleeding. I'm just going to tighten that up on that leg. And you have to be careful because you got to make sure that it still gets blood flow. So you're going to check every 15 to 20 minutes and loosen it up for about 20 seconds and tighten it back up. And then after that, the doctor should be coming in, looking at the wound, and that's how you control bleeding and do first aid for a bleeding patient. Hey, I'm Jade Clifton, and I'll be explaining how to take care of an animal with chemical burn or severe burn. So first, you'll just want to put the muzzle on the animal, and then for the chemical burn, you'll want to flush the burn immediately with large quantities of water, just to clean that out and make sure to get the chemicals out. And then for the severe burn, you'll muzzle the patient also and quickly apply ice and water compression to the burn, and then just wait on your doctor to tell you everything else that he wants. Hey, I'm Jade Clifton. I'll be showing how to do first aid on an animal that is choking. So first, what you're going to want to do is check those gums. And let's just say this patient's gums are blue. So we're going to look down the airway to see if there's any obstructions that we can get out, or if there's not, we will have to do the Heimlich. And what you're going to do is at the end of the ribs, you're just going to press for a gust of wind. And then if that does not clear up the airways, we're going to put on the side and do the same exact thing. And hopefully that it comes out, or hopefully the doctor's there by the time that happens. But that's how you do first aid on a choking patient. Hey, I'm Jade Clifton. I'll be showing how to do first aid on a heat stroke patient. So first off, we already got the temperature and it was around 106, and that's typical for a heat stroke. So we're gonna take some wet towels and we're just gonna place it around just to cool off. And what you're gonna want to do is you're gonna want to continuously wet these towels so they stay cool, and continuously grab that temperature to make sure that we're going down and not staying around the same temperature. And you're gonna want to get the doctor to come in and look at the patient. They might want you to set an IV catheter for some cool fluids to help cool down. And just make sure to keep the patient really cool. And that's how you do first aid on a heat stroke patient. Hey, I'm Joy Clifton, and I'll be showing how to do first aid on a patient that is in shock. So first you're going to want to check the gums, the capillary refill time to make sure that the body is refilling the blood fast enough. And then you're going to check the femoral pulse to check the blood pressure. You're going to osculate the heart to make sure that it is beating where it needs to be. And then you're going to get your doctor in, and whether he wants you to set an IV, things like anything that he wants you to do, you just need to assist him with that patient. And you just need to make sure that you keep level as possible, and that's how you do a first aid on a shock patient. Hey, I'm Joy Clifton, and I'll be showing how to do first aid on a poison patient. So we got a call saying that their dog had gotten into chocolate. And so and they're not a normal patient of ours, so we got like the weight and the breed and what chocolate that they had gotten into. And so first of all, we're going to give them the poison control number because they deal with that every single day. So you give them that number, and then you talk to your doctor, and if they want to try to induce vomiting, you give them how much of a dose that they need to make their dog vomit. And then you need to tell them to bring it in if possible so that we can look at it and do blood work, stuff like that if need be. And just basically let our doctor tell us what to do with that. And then if they do bring it in, tell them to bring in what they ate if they still have it. And of course, give them the poison control number so that they can call them. And yeah, that's how you take care of a poison in first aid. Hey, I'm Jade Clifton. I'll be showing how to take care of a seizure patient. So you want to make sure that your patient's on a padded area, and I have it on a pad and a towel. And you're going to make sure that there's not a ton of objects around. It's best if there's not really any objects around. And you're going to make sure everybody stays in like a whisper voice around the patient. And we can also turn the lights down also. And you can also, if it's safe for the patient, you can put an elevation underneath their head like this. And we're going to want to time the seizures to determine what type of seizures our patient is having. And then we get the doctor, and we just basically follow what he says. If he wants us to get anti-seizure medicine up, set an IV catheter, just whatever he wants us to do, just follow along with what he wants to do, and that's how you take care of a seizure patient. And I have also watched the instructional video and read the assignment attachment.